Good afternoon, everyone. Happy New Year to you, and thank you for joining us today on our webinar, the groundbreaking report that was released on financial capability of adults with disabilities. My name is Michael Rausch, and I will be the moderator for today's webinar, and I am the director of the Real Economic Impact Network at the National Disability Institute. Before we get started, I would like to go over some housekeeping tips with you. The audio for today's webinar is being broadcast through your computer. Please make sure your speakers are turned on or your headphones are plugged in. You can control the audio broadcast via the audio broadcast panel. If you accidentally close the panel, you can reopen by going to the Communicate menu at the top of the screen and choosing Join Audio Broadcast. If you do not have sound capabilities on your computer or prefer to listen by phone, dial 1-650-479-3207 and enter the meeting code 668-610-125. Please note, you do not need to enter an attendee ID. Captioning, real-time captioning is provided during this webinar. The captions can be found in Media Viewer panel, which appears in the lower right corner of the webinar platform. If you do not see the captions, you may need to open the Media Viewer panel by selecting the Media Viewer button in the upper right corner of the webinar platform. If you want to make the Media Viewer panel larger, you can minimize other panels like chat, Q&A, and/or participants. For questions and answer time, please use the chat box or Q&A box to send any questions you have during the webinar to Michael Rausch or NDI admin, and we will direct the questions accordingly during the Q&A portion. If you're listening by phone and not logged into the webinar, you may also ask questions by emailing those questions to me at mroush@ndi-inc.org. Please note this webinar is being recorded and the materials will be placed on the National Disability Institute website at www.realeconomicimpact.org. If you experience any technical difficulties during the webinar, please use the chat box to send a message to the host, NDI admin, or you may also email Katie Achenbach at KAUCHENBACH@ndi-inc.org. We are excited to bring you this information again on a new report that was released on the financial capability of adults with disabilities. Again, we'd also like to thank our sponsor, the FINRA Investor Education Foundation, for their support of this report and the support of this webinar. With that, I would like to turn it over to our first presenter, and that is Michael Morris, who's the Executive Director at the National Disability Institute. Michael, I'll turn it over to you.
Okay.
Thank you, Michael, and it's a pleasure to be with you and with people across the country to share with you what we learned from this research that resulted in the report that was made public in December. Let me tell you a little bit. Most of you, or maybe all of you, are familiar with National Disability Institute. We were incorporated in 2005, and we envision as our mission a world where people with disabilities have the same opportunities to achieve financial stability and independence as people without disabilities. All of us are familiar with the Americans with Disabilities Act, which was signed 27 plus years ago, but we all know that there remain substantial challenges for adults across the spectrum of disabilities across the country to make ends meet, to plan ahead, to manage financial products and services, and improve financial decision-making. Well, when we look at building financial capability, what are we talking about? It's really the capacity based on knowledge, skills, and access to manage one's financial resources effectively. We do know from research we have done and others have done that low financial capability will further negatively affect financial stability and security. And we know that people with disabilities face significant barriers to financial stability. Why is that so? Well, we know that low and or unstable income compounded by the extra costs of living with a disability, which may result from purchase or need for assistive technology, personal assistance, additional health care costs, make it more difficult for many individuals with disabilities to achieve financial stability. We also know that financial decisions for people with disabilities, millions of individuals with disabilities, can be often further complicated by interactions with public benefits that have challenging rules of eligibility that limit an individual's ability to produce more income and control and develop more assets. Although many adults with disabilities are living in poverty, we do know that there is an optimistic view of a new generation of individuals with disabilities who have benefited over the past 20-plus years from civil rights protections to receive equal educational opportunities in their neighborhood schools, are attending colleges and universities in record numbers, and are entering the workforce in increasing numbers as well. Employers across market sectors are recognizing the talents and contributions of individuals with disabilities and are actively engaged in active recruitment and hiring of people with disabilities as a positive part of their strategy to have a diverse and inclusive workforce. The report that you are going to hear about today analyzes data from the FINRA Investor Regulatory Authority, FINRA, Investor Education Foundation's National Financial Capability Study to reveal the most comprehensive picture to date of how people with disabilities manage financial resources and make financial decisions. Now, the statistics you're going to hear about from our senior researcher, Nanette Goodman, really present a rather full picture. But I think what's really compelling for all of us is that this picture has begun to change, and we'll talk more about that after Nanette presents her findings. But it also compels all of us of the need for an important framework for continuing to change the design of programs, products, education, and services that can, and we're beginning to prove, can improve the financial stability and capability of our nation's most economically vulnerable population, individuals with disabilities. So I will turn it next. I don't know if I turn it back to Michael or I introduce you, Nanette. I think I'll go ahead and introduce you. Nanette Goodman is our senior researcher who led the work on this study with Bonnie O'Day, who was a consultant to us. And many of you know from her many positions in and outside of her work at National Council on Disability, her work with Mathematica and others. Nanette has a long history of work as well with different research institutes, as well as a time also within the federal government. And I will turn it over to you to present What Did We Learn?
Thank you, Michael. So I'm going to talk a little bit about what we found when we analyzed the National Financial Capability Study. First, let's talk about the purpose of the report. The survey asked a wide range of questions looking at questions in 4 different areas: making ends meet, planning ahead, managing financial products and services, financial products and decision-making, and financial products and decision-making. And for the first time, the NFCS comes out, is administered every 3 years, but this is the first time they've asked questions to identify people with disabilities, and that's thanks to the excellent advocacy of our fearless leader, Michael Morris, who had been bugging them for years to do that. But what we ended up with is a really rich picture of people with disabilities. This is a large survey, and with about 25,000 people with disabilities, 25,000 respondents with about 5,000 people with disabilities. So let me first talk about how we identify people with disabilities in the survey. The survey asked the same 6 questions as are included in the American Community Survey, the National Health Interview Survey, and a wide range of large federal surveys. And we define people in our analysis as people who said that, yes, they had serious difficulty with hearing, seeing even when wearing glasses, remembering, concentrating, or making decisions, walking or climbing stairs, bathing or dressing, and doing errands alone, such as shopping. There's also a question on the survey that asks about whether they're working, and if they responded that they were not working because they were permanently sick, disabled, or unable to work, we considered them to have a disability also. Let me just point out that we are focusing on people who are working age 18 to 64, because although the incidence of disability, the prevalence of disability increases with people over 65, they face a much different set of challenges. So we're focusing on the working age. So like I said, there are about 25,000 people with people in the survey. About 5,000 of them had a disability. They are disproportionately older. They disproportionately have lower levels of education. 39% of the disability respondents had a disability. 39% of the disability respondents had only a high school degree or less, compared to only a quarter of those with no disability. But like Michael said, there are a large group of people who have higher levels, people with disabilities who have higher levels of education. The other thing that's important to note is that in the survey, and that's borne out in other surveys, many people with disabilities are either unemployed or, more importantly, not in the labor force. In our survey, in this survey, 40% of the disability population was employed compared to 70% of those with no disability. They are disproportionately lower income. 26% had income under $15,000 compared to 11% of those with no disability. But again, like Michael said, there are a group of people, 15%, who had incomes of over $75,000. So we looked at the data using 4 hypotheses. And these hypotheses are built around sort of what we needed to know, and also recognizing the differences in the socioeconomic and demographic characteristics of the population. So first we say generally, do adults with disabilities have lower levels of financial capability than those without disabilities? And for that, this is just a simple comparison of two populations, those with disabilities and those without disabilities. Then we ask, are there some disability subpopulations that are more at risk than others? So in this analysis, we look at each variable by a variety of socioeconomic characteristics, including gender, race, ethnicity, age, education, employment status, household income, marital status, dependent children, and disability type. And we ask, are there some of those groups that are even more at risk than others? And then we ask a kind of complicated but very important question, which is, does disability have an impact on financial capability even after we control for other socioeconomic characteristics? And this requires some multivariate analysis that I'll talk about in a few minutes. And our fourth hypothesis is that the disparity has not changed significantly in the last 3 years. And like I mentioned, this is the first year FINRA has asked the 6 disability questions. So there are some technical issues with the comparison looking back 3 years. We can only do those comparisons based on the people who said that they were not working because of a disability. So you can read about this comparison in the report, but we're not going to talk about it today. So let's look at one variable through those 3 lenses. In this case, we're going to look at the difficulty covering expenses and paying bills. First, we compare adults with disabilities, age 18 to 64, to those of the same age group without disabilities. And while 23% of those with a disability find it very difficult to make ends meet, only 9% of those without a disability say the same thing. That's the red part at the end of each tube. On the other end, only a quarter, 26% of those with a disability, say they have no difficulty compared to half of those without a disability. So this is a pretty big disparity. It's sort of our first indication that people with disabilities are having a lot more trouble making ends meet than people without disabilities. Although it's important to note that there are a lot of people without disabilities having difficulty also. So our next hypothesis was that certain subgroups are at increased risk. So here we look at gender, education, and household income. And if you look at the report and also in the appendix of the report, you can see this data by a huge number of variables. So the things that are important to note are that those with a disability are more likely to have difficulty making ends meet regardless of their other characteristics. So for example, women are more likely to have trouble making ends meet than men regardless of whether they have a disability, right? So 10% of women with no disability have trouble compared to 7% of men, and 27% of women with a disability compared to 20% of men. So women always have more trouble, but people with a disability have even more trouble than women without a disability. And you can see the same thing in education, right? As people's education gets higher, people with a college degree have less trouble than people with a high school degree or less. But even people with a college degree, those with a disability have even more trouble than those without a disability. And this is true for income. So while the richer you are, the less trouble you have making ends meet, people with disability, higher income people with disabilities have more trouble than higher income people with no disabilities. And lower income people with disabilities have more trouble than lower income people without disabilities. So what we see here is that there's a lot going on by socioeconomic characteristics. So when we looked at the characteristics of the disability population, we know that people with disabilities are more likely to be lower income, more likely to have lower levels of education, and less likely to be employed. And all these characteristics are correlated with difficulty making ends meet. And these characteristics are correlated with each other. Less education and lower income often go together. So given all this, we ask the question, is the difference in financial capability, in this case difficulty making ends meet, the result of the difference in the socioeconomic characteristics, or is there something going on that's directly related to disability or in the way that disability is interacting with other characteristics? So this is kind of a tough concept, but we can talk about it more if you have questions about it. But in order to sort out the effects of the socioeconomic characteristics from disability status, we did some multivariate analysis. And I have to say, as a researcher who plays with large data sets, this is the point where things get really exciting. You know, I don't know if anybody on the phone does any data analysis, but you know that experience when you've spent weeks getting to know the data, running crosstabs, making tables, and you do a multivariate model and you click on Run Program, and in 2 seconds, the world comes into focus. You understand everything. So the finding that I'm about to explain isn't particularly surprising, right? Every individual with a disability would say, duh, but the strength of the statistical finding was really surprising. And what we found was that 30% of the difference in the ability to make ends meet can be explained by socioeconomic characteristics, but 70% of the difference is explained by disability status, or the way disability status interacts with socioeconomic characteristics. This means that people with disabilities are having trouble making ends meet for reasons in addition to their socioeconomic status. So it's not just that they're more likely to be poor or more likely to have lower levels of education. It's something directly related to disability. And this is a really strong statement, which will feed into a much larger issue about the financial lives of people with disabilities. We have some ideas about why there's this big difference, and I think Michael mentioned them. There's extra cost of living with a disability. There's a level of uncertainty associated with living with a disability. But we're going to be spending the next year or so trying to really work out exactly why we see this kind of result. So from this point forward, I'm just going to look at that first, I'm just going to look at that first level of the hypothesis, which is that overall comparison between those with and without a disability. So first we're going to look at making ends meet. And I immediately violate what I just say. But first, let's look at the ability to come up with $2,000 in an emergency. And remember, here we're not asking, do you have $2,000 in an account? We're asking, could you come up with it? Could you borrow it from family and friends? Can you put it on a credit card? Can you sell assets? So this varies a lot by income, but like the variable we looked at before, people with disabilities at each income are less likely to be able to come up with $2,000. So people at higher, among people with disabilities, 75% of those with less than $15,000 could not come up with $2,000. But for higher income people over $75,000, only 22% couldn't come up with the money. But that's still higher than people without disabilities. But let's face it, people who are in those low income categories, regardless of disability, are having a lot of difficulty. For people with less than $15,000, 66% of those with no disability are would be unable to come up with the money also. So while it's important to focus on financial education and financial literacy, part of the issue here is that people with disabilities don't have enough income to start with. So here we look at indicators of financial stress. People with disabilities are more likely to overdraw their checking account, more likely to have been late with mortgage payments, more likely to have taken hardship from their retirement accounts or taken loans from their retirement accounts. And these are just evidence that they're having trouble. One of the other measures of financial stress is past due medical bills, and people with disabilities are much more likely to have past due medical bills. The data showed that 38% of people with disabilities had past due medical bills compared to only 18% of those without disabilities. This was actually a little surprising to me because people with disabilities are equally likely to have health insurance. And although fewer have insurance through their employer, more are enrolled in Medicare and Medicaid, which tends to cover a lot of things, especially disability-related expenses, better than private coverage. But what we see is because people with disabilities have so much more medical care, they have more likely to have past due medical bills. But while the past due medical bills are problematic, what kept me up at night when I was doing this analysis was the finding that people with disabilities are more likely to avoid the doctor, skip a test or medical treatment, or not fill a prescription because of costs. Almost half have done at least one of these things over the course of the year. And this is a really big issue given that people with disabilities have what we often call a thinner margin of health. And this is where, we always talk about financial health impacting physical health. This is a really direct way that financial health impacts physical health by exacerbating a disabling condition. And the next set of questions talked about planning ahead. We have a few measures of planning ahead. So we ask whether the family has a household budget, have they set aside 3 months worth of emergency funds, and have they set long-term financial goals and strove to achieve them. And what's really striking to me is that people with disabilities are actually more likely to have a household budget than those without disabilities. So they're doing the right thing, but when it comes to their ability to set aside 3 months worth of emergency funds, they're less likely to be able to do that, and they're less likely to have long-term goals and strive to achieve them. And part of this is because of their time horizon when they plan ahead. What we find is that people with disabilities, when they're planning, tend to have a shorter time horizon. They think about, making ends meet or how they're going to cover costs in the next few months. More than a third are concentrated only on the next few months, compared to people with no disabilities, where a quarter of them are focused on the next few months. As compared to people who are really thinking long-term and making investments in the future, people with disabilities are much less likely to be planning 5 years ahead when compared to those with no disabilities. The survey asked a lot about managing financial products. And for those of you who were on our webinar about the FDIC study, this is sort of a repeat, and what this survey shows, and which is the same thing the FDIC survey showed, is that people with disabilities are much more likely to be unbanked. And even if they have a banking account, they're much more likely to have just a checking account and not have a savings account. They're also much more likely to use non-bank borrowing. The question asked about pawn shops, payday loan, rent-to-own, and auto title loans. And then it asks, and any non-bank borrowing is basically, did you have a loan from any of those other places? So 42% of people with disabilities used one of what we would generally consider a predatory lender, compared to 25% of those with no disability. So this is a really problematic finding, and really, makes us think about, well, how can we provide loans that are not predatory to people with disabilities? And then we ask about financial decision making, and the survey asked 6 financial knowledge questions, which test the respondents' understanding of interest rates, inflation, bond prices, mortgages, risks, and compound interest. And generally, people with disabilities do slightly worse than on these sort of what I would call quiz questions than those without disabilities. Some of that difference washes out when you look at education status and income status, and since some of the questions are really about investments, it makes sense that lower income people who are not investing wouldn't be familiar with some of those concepts. But the survey also asked about access to financial education, and what we find is that people with disabilities are pretty similar to those without disabilities, in that 1 in 5 adults with disabilities participated in formal financial education programs. 41% learned how to manage their finances from their parents, which is great, but for some of the issues around financial management for people with disabilities, parents may not have the best information. One of the key things here is that we know that parents tend to be a little overprotective when it comes to maintaining benefits. So there's a role for financial education programs, even when people do learn how to manage from their parents. But what we find is that 36% didn't learn from their parents and were never offered financial literacy education from their school, college, or workplace. So they're really left out there winging it, and many of them are not doing so well. So I think there's a lot of room for us to make change. So overall, what we find is that people with disabilities have lower levels of financial capability than those without disabilities on a number of measures, and that people of color, women, and those with low income or low levels of education are more at risk of poor financial capability, and that disability has an important impact on financial capability even when we control for other characteristics. And now I'm going to kick this back to Michael. Sorry.
Nanette, that's back to Michael Morris, right?
Yes, Michael Morris.
Yeah.
Sorry about that.
Perfect. All right, just making sure. Great. Michael, we'll turn it back over to you.
Michael. All right. Well, those statistics are sobering. They're not positive, but I think that, as I pointed out in my first few opening slides, I think it's also a picture that's changing. What all of us, and many of you on this call, have been working on for more than a few years now is how to take findings like this and translate that to different types of supports, interventions that can make a difference. I think we all know that whether you represent a financial institution, whether you're a person with a disability, whether you work for a government agency or you work for a community nonprofit that's providing support or part of the advocacy on behalf of people with disabilities, that we need to really rethink our approach, our structures, our policies and processes to change thinking and behavior for individuals with disabilities and also at a system level. And at a system level, both in terms of what financial institutions offer, but also in terms of what our major public funders are providing. The goal of financial health and well-being requires all of us to pay attention to these statistics. It requires even further levels of cooperation and investment of individuals with disabilities to really push for higher levels of expectation about what's possible in terms of achieving financial stability and improving financial capability, and that there is a role for government, financial institutions, and community nonprofits to coordinate and collaborate in terms of resources and interventions that we continue to test and are beginning to prove can really have a positive impact. Next slide. We know that there are teachable moments. Over 12 million individuals with disabilities are receiving Social Security benefits between the ages of 18 and 65. We know that over 1 million individuals a year receive supports from the vocational rehabilitation system, and several million individuals receive benefits as a result of Medicaid or Medicare. We also know that there are millions of children in the public education system. And for each of these systems, there are teachable moments where we should be helping individuals with disabilities, children, youth, adults with disabilities, understand the importance of financial capability, what that means, making better decisions, having better control and management of financial resources, setting financial goals, providing financial education and coaching beginning at a younger age, beginning in the schools, not waiting till youth transition out of high school, but looking at these issues at an earlier age and helping individuals improve financial decision-making. We know, too, that there is now opportunities with the Achieving a Better Life Experience, or ABLE program, with programs now in 29 states and the District of Columbia, lots of choices, but new opportunities for an individual with a disability to control financial resources beyond the what has always been difficult, the limitations on assets and means-tested programs like SSI, Medicaid, food, and housing assistance. ABLE offers a new set of opportunities, a new set of expectations, and there are ways we could be helping individuals with disabilities become more ABLE-ready and consider it as an option. We know, too, that there must be increased collaboration and communication between the nonprofit world in the disability community and financial institutions. And financial institutions, particularly banks that are subject to Community Reinvestment Act requirements, have meaningful ways that they can partner with disability nonprofits, offering financial education and financial coaching, helping even with workforce development programs and projects to get credit for their reaching out and serving people of low and moderate income, including individuals with disabilities. We know that there has been now for several years an emphasis by FDIC through their regional community affairs offices, and this priority is continuing with their development of new materials targeting people with disabilities to improve their financial capability as a pathway to financial inclusion. If you haven't worked with the FDIC, you should know that there are offices in all regions of the country, and there are staff there within their community affairs regional offices who are willing and interested in talking with you and providing new education opportunities with new materials that are coming from MoneySmart that are now available and more to come in 2018. We hope you'll look to NDI for additional material and ways we can support you in terms of how do we integrate building financial capability within our social and human service programs, within our employment service and support programs, within our community living and independent living support programs. These are things that some of you on this call and others are now exploring, trying to find and build that individualized pathway to a better economic future for youth, young adults, and working age adults with disability. We provide you the link to the FINRA report as well as a report from the Federal Reserve, their survey of household economics and decision making. Prior slide. Whoops, go back. Slide. Going the wrong way.
Sorry. Oh.
Yeah. These reports may be of interest to you. And then next slide. There is the link to the new materials from MoneySmart, a guide to presenting MoneySmart for adults with disabilities, and a series of case scenarios and how to solve them in terms of individuals with disabilities with different needs, whether it's technology or home modifications or support to improve their economic status and be a part of the workforce. So there are some really good new materials worth taking a look at. Next slide, please. So we do hope that you will think about these statistics as not, oh my gosh, this is overwhelming, but this really is a clear and urgent call for more of us to get engaged, to bring the development of financial capability, financial education and counseling and coaching into the service delivery system that many of us are a part of, and looking at ways to team up with financial institutions.
And if you're willing to be a guinea pig for National Disability Institute, we'd love to hear your story. Like I said earlier, we're really trying to get a better understanding of exactly why these statistics play out the way they do, and we're sure that a lot of you are probably sitting there going, oh, I know that, I understand that one. And if you'd be willing to share that with us, please email me, and we'll set up a time to talk.
I'm going to turn it back to you, Michael.
That would be Michael Raff.
Right. Michael 1, Michael 2. So back to Michael 2 here. Yes. So excellent. Thank you both for sharing this information with us today and sharing the information to let us see what the data is showing about individuals with disabilities and how moving forward we can change this data for individuals. So we have received several questions that have come in via email and the chat box. If we're going to try to get through as many of these questions as we can. If you have additional questions, please put them in the Q&A box, or you can send them to me via email, and we will make sure to get through as many questions as we can. So the first question that came in is, do you think the results of the studies are because people with disabilities aren't finding employment, or because they think it is too complicated to get off of Social Security and Medicare or Medicaid or Medicare?
I'll take that one. I think the answer is yes. I think that those are both issues. Remember, only a portion of the people in the survey were receiving benefits, but benefits, I think, we often talk about SSI as a poverty trap, and you definitely see that in the data. When what we do know about people using savings accounts, we know that some people are hesitant to use savings accounts because they're afraid of they're afraid that of hitting a $2,000 limit in their savings account. Because that'll put their SSI at risk. Employment is a big issue. Employment is the single way to have more money, and the low employment rate of people with disabilities and the challenges in becoming employed really play into this data quite heavily.
Great. All right. So the other question that came in that goes along that, and I kind of touched on it, but it says, did the study look at how many received a public benefit like Medicaid? So out of the 5,000 you mentioned, did it identify the specific public benefit that they received?
It didn't talk about the specific public benefit. It did talk about public benefits. And it was really interesting analyzing a survey written by non-disability people because it doesn't allow us to really clearly see what's a disability benefit or what's a safety net benefit. But when we talk about where people get income, what we see is that people with disabilities are much more likely to have received income from a public source than people without disabilities. So, yeah, like the other questioner mentioned, that really has an impact on people's ability to manage the resources that they have because of the constraints put on by those programs. And it's not just SSI, SSDI. It's all sorts of means-tested programs.
Great. So the next question that came in, which this comes up every time, and Nanette, I knew we'd have this question again and received it from a couple people, is to define, provide clarification on the definition. The person is asking, saying, about defining disability, it seems you're missing people with mental health diagnoses or cerebral palsy or even autism.
So that's a really good question. And the way that the 6 questions were developed is they really looked at functional impairments, rather than looking at a particular type of disability, it's what is the type of functional limitation or functional impairment. So somebody with cerebral palsy would likely fall under somebody who was having mobility difficulties. So that's where it would be caught. So we wouldn't be able to say, oh, let's look at this population of people with cerebral palsy. We could look at this population of people with mobility limitations. And there's a lot of reasons that the questions are designed that way. But the issue around mental health disabilities is more difficult to answer. And that is that we hope that many of them are caught under the question of difficulty making decisions. I forgot the exact wording. But the 6 questions do undercount people with mental health issues. That's kind of a known problem. The 6 questions are used on a lot of federal surveys, and that's why we recommended they be used on this survey also, but they're not perfect. But as a group, they do tend to pick up a very important group of people. So the mental health question that I was talking about is, because of a physical, mental, or emotional problem, do you have difficulty remembering, concentrating, or making decisions?
Great.
So, right, that can be a mental health issue, it can be an intellectual disability, it could be a lot of things. So it's hard to look at each individual question and know what we're getting or who we're capturing, but when you look at the 6 questions as a whole, we tend to capture most of the disability community.
All right, great. Thank you for that. So I think you already addressed this question, but I'll ask it again. How do the banking status or stats compare to the previous report on the banking status of people with disabilities?
They're very similar.
Not significantly.
Not significantly different. People with disability, about 12% of people with disabilities are unbanked. They ask the question slightly differently, so the only comparison is the unbanked. This doesn't give us an ability to ask that exact question about whether they're underbanked in the same way, but the unbanked is almost exactly the same.
Okay, great. So we have a few more questions here. So has there been any data looking at youth with disabilities and their financial knowledge?
That's a great question, and this, the sample for this survey wasn't large enough to look at youth. So I would recommend that that person advocate to somebody because that's a really critical question. But no, we don't have anything.
Okay, great. Yes, so we that person, please follow up again, and we can look at that even further. Next, just pulling this up here. Okay, so the next question is, how is formal financial education defined? Is that workshop, online?
So that's a really good question. Not that the other ones weren't also good questions, but I guess I say it's a really good question when I don't really have a good answer to it. That makes it a harder question. And they just say, did you have access or did you get the education through, you know, a school or an employer? It doesn't say how you got it. And I have to say, again, you know, the survey was designed not with disability in mind. So they ask about it in formal educational situations. They don't ask about, you know, did you get financial capability or financial education from your service provider or from another community, you know, or from some other community source. But no, they don't define how the modality.
Okay, great. So another question.
Although it would be great to know some modalities work better than others, but we can't tell that from this data.
All right. So we have 3 more questions that I hope we can get through in our next 7 minutes. So we'll do a little bit of a speed round here if possible. So as an independent living center, what can we do to help people with disabilities get on a path to financial success and employment plan?
It's almost like a plant of a question is, Centers for Independent Living have as a mandated service, if they're receiving federal funding, which most do, is providing independent living services. Within a broad and comprehensive definition of independent living services is certainly helping someone improve their financial knowledge, make better informed financial decisions, whether they're working full-time, part-time, or not working at all, and just trying to manage with resources that they have. I think every independent living center could be offering, and a growing number do offer, financial education classes. There are some that are offering one-on-one financial counseling. And we know, and Michael, I know you'll talk about it in terms of next month's webinar to the Real Economic Impact Network, we know that there are examples that we hope we will share with you next month, because it seems that for those independent living services that, whether it's independent living or employment supports or offering benefits planning and counseling, there are natural tie-ins to also help an individual begin to look at and be engaged through a financial health assessment, and then help that individual with setting goals, and then support that individual through individual counseling, as well as there are some centers that also have created peer support groups, so that there is a place to talk about what typically has been uncomfortable or not covered, is really how to manage my finances and make better decisions and set goals for the future.
Great. Thank you, Michael. And to the person who asked that question, I'm in the chat box. I'm going to put an email address, and anybody can send a message. But we have some great tools, as well as we have a community of practice that will be starting up most likely in March of this year, on helping organizations integrate some financial education and some other tools into their service of delivery. And so in the chat box, I'm putting an email address. It's ask@ndi-inc.org. If you send an email to that, then we will send you some resources that Michael had mentioned, but also would like to invite you to participate in a community of practice that will be starting up in March. We're going to take one more question, and then we'll need to wrap it up. And the next question that came in is, do you have any data that suggests that financial capability impacts ability to obtain employment?
We know that financial capability impacts ability to get employment in a number of ways. But is there any data that that makes that direct correlation? I'm not exactly sure. You know, there's a lot of anecdotes about, you know, employers checking credit reports and that being a limitation of ability to get employment. If you don't have a bank account, it's really hard to do direct deposit. There actually is some work out there on financial stability and whether people can keep focus on job searches when they're worried about how they're going to live or eat the next day. And that's not sort of disability specific. It's about the broader population of people who are financially precarious. And do you have anything else to add, Michael?
No, I think that's good.
Yeah.
Okay. And again, thank you, Nanette, for sharing that. And to that person, if you also will send us an email at ask@ndi-inc. As Nanette mentioned, there's not any direct, but there's been some great reports that have been put out by the Asset Builders Alliance, as well as on our website. I believe they're on our website. We have a PowerPoint and presentation that shares some more information on case studies and best practices, as well as you can go to the leadcenter.org. I hope I have that right, that website, leadcenter.org. Sorry to my colleagues if I got that wrong. But you can also find some additional resources there on that particular topic, not specific on data, but we'll give you some more information on the correlation between financial capability and employment. With that, I'd like to say thank you again to Michael and to Nanette for sharing this information. If you all are new to this webinar series and to the Real Economic Impact Network, I hope you'll join us and be a part of this conversation as we move forward to work together to build a better financial future for individuals with disabilities. I hope you'll join us on February 14th at 3 p.m. as we take the teachable moments, or the findings from the study, and we're going to highlight groups who have taken some of this information and are putting it into action when it looks to increasing the banking of individuals, how they're incorporating ABLE-ready programs into their service of delivery. And so we'll be highlighting some of those organizations, and they'll be presenting where we are going to be looking at turning research findings into action. You will receive an email on that as well. I would like to say thank you also to my colleagues at the National Disability Institute, our training and technical assistance team who helps put this information together, as well as our communications team who facilitates the behind the scenes in so many things that we do. And so we're very grateful for them. So with that, Happy New Year to everyone, and thank you so much for making a real economic impact for people with disabilities. Have a great day.
That was good. You can write it up.